Hey there, and welcome. In this explainer, we're going to break down Losartan. It's a really common medication that millions of people take for their heart and kidney health. Our whole goal here is to give you the essential info so you can feel clear and confident about it.
So, whether you've just been handed a new prescription or maybe you've been taking it for a while and just want a refresher, you're in the right place. We're going to walk you through what it is, how it works, and what you need to look out for. Here's a quick look at our game plan. We'll start with the basics. What even is Losartan? Then we'll get into the cool science of how it actually works inside your body. After that, we'll cover the practical stuff, how to take it right, what side effects you might see, and some really critical warnings. And we'll wrap up by getting you prepped for your next doctor's visit.
All right, let's dive right in. Part 1. What exactly is this medication?
So, Losartan is probably best known by its brand name, Cozaar. It's part of a family of drugs called angiotensin II receptor blockers, which is a mouthful. So most people just call them ARBs. And it's really a cornerstone for managing certain heart and kidney conditions.
So what's it officially for? Well, the FDA has given it the green light for three main jobs. First and foremost, it treats high blood pressure. It also helps lower the risk of a stroke in some patients who have both high blood pressure and an enlarged heart. And third, it's used to treat kidney disease that stems from type 2 diabetes.
And just to give you an idea of how common this medication is, get this. In 2023, Losartan was the 8th most prescribed drug in the entire United States. We're talking over 56 million prescriptions. So if you're taking it, you are definitely in good company. Okay, on to part 2. How does this little pill actually do its job? It's pretty fascinating what's happening inside your body when you take it.
So, to understand Losartan, you've got to know about this thing called angiotensin II. Just think of it as your body's natural squeeze chemical. It's a hormone that travels around and tells your blood vessels to tighten up, which, you guessed it, makes your blood pressure go up.
And this is where Losartan steps in. It's basically a blocker. It gets in the way and stops angiotensin II from delivering that squeeze message. So, the result? Your blood vessels get the signal to chill out and relax. They widen, which lowers your blood pressure and makes it way easier for your heart to do its job.
Okay, so we know what it is and how it works. Now for the really practical stuff. How do you actually take it correctly?
The good news is the routine is super simple. Losartan is just a tablet you take by mouth, and for most people, it's just once a day. You can take it with food, without food, whatever works for you. The most important thing, though, is to be consistent. Try to take it around the same time every day so you keep a nice, steady level of the medicine in your system.
But, of course, the dosage is not a one-size-fits-all kind of deal. Your doctor will figure out the perfect dose for you. As you can see here, for most adults with high blood pressure or diabetic kidney issues, a common starting dose is 50 milligrams a day. But check this out. For someone with liver problems, the doctor will often start at half that dose, just 25 milligrams. It's all tailored to you.
All right, let's move on to part 4. We have to talk about side effects. With any medication, it's just smart to know what you might expect. So here's some more good news. Losartan is usually really well tolerated. A lot of the common side effects are pretty mild. We're talking about things like feeling a little dizzy, maybe a stuffy nose, some back pain, or muscle cramps. Often, this stuff just fades away as your body gets used to the new medication. Now, on the other hand, there are some more serious signs you absolutely need to watch for. If you ever experience swelling in your face or throat, have a hard time breathing, get chest pain, or feel so lightheaded that you think you might pass out, those are your cues to call your doctor right away. Don't wait on those.
Okay, everyone, this next section is so important. These are the critical warnings that anyone taking Losartan absolutely has to know about.
So, Losartan comes with something called a boxed warning from the FDA. That is the most serious warning they put on a medication. And I'm just going to read it directly to you. When pregnancy is detected, discontinue Cozaar as soon as possible.
Let me be crystal clear here. You should not take Losartan if you are pregnant or even thinking about becoming pregnant. It can cause devastating harm or even death to a developing baby. If you're on this medication and you find out you're pregnant, you need to talk to your doctor immediately. Another really important warning has to do with potassium. Losartan can sometimes cause your potassium levels to get too high. Because of that, you really want to stay away from potassium supplements or those salt substitutes that are made with potassium unless your doctor has specifically told you it's okay.
And you should know Losartan can interact with other common medicines. Things like NSAIDs, think ibuprofen or naproxen, can actually make it less effective and can be tough on your kidneys. It can also have interactions with lithium and other blood pressure meds. The bottom line here is simple. Your doctor needs to know every single thing you take. Prescriptions, over-the-counter stuff, supplements, everything.
Whew, okay, we have covered a ton of ground. So let's wrap this all up by talking about how you can feel super prepared for your next appointment with your doctor.
You are your own best advocate, so go into that appointment armed with questions. You can ask things like, is this still the right dose for me? Or what specific side effects should I personally be watching for? It's also a great time to double-check about any interactions and ask how often you should be getting your blood pressure and kidneys checked.
At the end of the day, knowledge really is power, especially when it comes to your health. The more you understand your medications, the better you and your doctor can work together as a team. Thanks so much for watching.